same thing, but on this side you can't bring your knee up quite so high. And I'm going to help you just a little bit in the beginning, okay? Just because it's a little bit stiff. That's good. And let's start there and then down. And you can, again, you can press down gently here. There you go. It's probably a little hard to push. There you go. Feeling okay?
Oh, yeah.
Okay. Let's see if you can, yep. You've got lots of room here. That's it. Now make sure you come all the way down and press down. Good. Nice job. All right. Let's do, now you remember how much weight you can put down through your leg?
You said as much as I wanted.
Okay. Yep.
So I remember weight bearing or something like that. Or
Yeah, weight bearing is tolerated. So we're going to do a little exercise here to try and just kind of get your bum, your buttocks a little bit stronger, okay? And a little bit of movement to help with bed mobility.
Buns of steel.
Buns of steel. So I'm just going to pull this up a little bit.
Okay.
What I'm going to have you do is bend your left leg, and that one you can bend up nice and high, right?
Okay, yep.
Good, okay. Now this one just bend up, not quite so far. Yep, right about there.
Okay.
And what I want you to do is I want you to just lift your buttocks off of the bed, maybe about 2 inches, so not very high. Yep, perfect, and then down. Good. How'd that feel?
That's fine.
Okay, so you can, good. And down. And we're going to do 10 of those, and nicely done.
10.
Good job. How'd that feel?
It's hard work.
It's hard, yeah.
But it's okay.
Now the reason I did that one with you is because that's a great one to help you move in bed, so you can lift up. Let's do a couple of those where you lift up and then just shift your weight to the.
Okay, yeah, because that's been my hardest
So
trouble.
you're gonna come
trying to
up
move
and
in
just
bed
shift.
and then I get
Oh,
stuck.
perfect. And then walk your feet over a little bit.
Much easier.
And that way you can get out of bed a little bit and you can
Okay.
position yourself and roll to your side.
Okay, that's
All right,
good.
nice. Okay,
Alright.
good. So I think we should probably look at getting up now. Are you ready for it?
Yeah, I am.
Okay. So because you're not able to bend very much, I'm going to teach you a technique that you're going to use most of your arms, and you're going to have to lean back so that you don't come forward.
Okay.
So what I'm going to have you do is you're going to use your elbows. You're going to kind of come up on your elbows and then your hands, but don't come too far yet.
Oh, and I messed up this over here.
yeah.
Boy, sorry.
That's all right. Let me bring that. Thank you for reminding me.
My lateral urethra.
Let's bring that over.
Oh my, that is quite dark. I guess
Yeah.
I do.
Woo.
Got a UTI.
Alright, how are we doing there? There we go. Okay. Alright, so what I'm going to have you do, since your left side or your right side is your strong side, your unaffected side, I'm going to have you use that as much as you can.
Okay.
I will help you with this side.
Good.
Okay. So I think we're probably good here to
Alright.
pull that off.
Okay.
Get this guy. I'll bring that along as well. So you use that one. I'm going to use this one. Okay. And that's it. Keep leaning back. Try not to lean forward. And that's where you can kind of bring your hips forward. Good.
Alright.
Now hold on just a second there.
Okay.
Okay. Now come forward. Keep coming. Don't lean forward too much. There you go. And we're going to just put that down. Okay.
Alright.
All right.
Yeah.
Look back there.
Good?
Yeah.
So? Think so.
Okay, now you're going to lean back just
sorry.
a little bit. There you
Sorry.
go. Good. That's okay.
Boy.
It's usually when we put those three movements together in a forceful manner that we get
Okay.
really
Alright.
serious. I mean, we don't want you to lean too far forward, but
Okay.
we don't want those. Now, the surgery was up here, not at your knee, so you can,
Oh, I
bend
can?
your knee.
Okay,
Yeah.
well, that's much better. I was
There you
wondering
go.
about that.
Yeah. You just you
Okay.
don't have to
Alright.
worry about
I
the
asked
knee.
the nursing assistant, but she didn't really know. So
Yeah, that's okay.
So I
That's-
was keeping it straight.
You know, it's job security for me.
Panicking.
So.
Okay,
Yeah,
well
no
that's
worries.
much better. I like
Okay,
that.
you doing all right there?
Yeah, I felt a
Feeling-
little dizzy, but now I feel
Okay,
fine.
feeling okay?
Yeah, now I feel fine.
Okay. Good.
Yes.
All right, so I think what we're going to do, actually what we are going to do, I'm not thinking about it, I know we're going to do
Okay,
it.
that sounds good.
So we're going to put you over in the chair, but we're going to do a stand, what we call a stand pivot
All right.
transfer. Okay, we're going to use this walker, and I just would like to make sure it's the right height for you. So
Yeah.
before you get up and move, let me put this belt on you, okay?
Is that to keep my gown all?
Well, it does help with that.
Oh,
but
does
it's
it?
just in
Oh.
case I need to hold on to you.
Okay.
I don't have to grab your arm or anything.
Oh, that's good. Yeah, because
Yeah.
my shoulders aren't so good either.
So I'm just gonna come a little bit above that incision.
All right. Now, my friend Betty.
Betty,
She gave me a walker,
okay.
but it doesn't have those wheels on it.
Yeah, that's a different kind of walker. I mean, you can, if you like that walker, we could just get you the wheels.
Betty's really short though. Is
Oh,
that going to be a
yeah,
problem?
that'll be-
Betty's
I'll
like
show you
4'10".
Okay, I'm gonna show you why here, okay?
Okay.
Because you want it to be, your height so that you can bear weight on it if you need to. Okay. So the way I'm gonna have you get up, I'm just gonna demonstrate. You doing okay?
Yep.
Sitting there?
Mhm.
Okay, do you mind if I sit down?
Oh, that's fine. Here, let
Okay.
me
Just
sort
sit
that
down here.
out for you.
Okay, so what we're gonna have you do is you're leaning back, and
Okay.
so we don't want you to lean forward, of course, because we'd be breaking your percussion, right? So what I'm gonna have you do is you're going to put, let's see, I always have to think about this. I want you to reach up with your right side, and the reason I'm having you do that is because if you reach with your left side, then that pulls you forward, and you automatically break your percussions. So you're gonna push off with your left and have your right hand here, and then when you
Okay.
go to come up, you're going to come up like this,
Oh, that
and
makes
then
sense.
put your, can you see what I'm doing? You're
Yeah.
gonna put your hand here.
All right, I can do
Okay.
that.
And then when you're up, then we can bring your feet back.
All right.
All right, let's try that.
Okay.
So, yep,
Alright,
up
so
on there with
up
your,
on there.
gonna push there. And I'm just
there.
going to reach around and give you some support
Oh,
in case
that's
you
good.
need it. Ooh,
All right.
Did that pretty good?
Yeah.
We're
Okay.
all covered back here,
Oh,
so that's
good.
good. I'm going to just tighten this a little bit.
All right. I lost some weight.
Yeah, whenever you stand up, you
Oh.
kind of do. Okay, so how are you doing there? Let's make sure.
How do I look?
Okay, stand as tall as you can. Yep, just drop the arm down, and that's pretty good. We want it to be about mid-wrist.
All
Okay,
right.
so it's pretty good right now. I
Okay.
think that'll be. So let's go ahead. We're going to go over how to sit back down.
Oh, okay.
Again, we don't want to have you bend, so I'm going to have you do the opposite. You're going to reach
Okay.
back with that hand.
What about? Should I do it? Should I?
Yep,
Is it all right to
and
do
kick
that?
that leg out, and then there you go.
Okay.
Okay.
All right.
And then reach back with this hand.
This one and then
lean
this to go.
back.
Okay.
Okay. You
All
good?
right. Oh yeah.
Should we try it?
Yeah, that'd be great.
Okay. So what we're going to do now is we are going to transfer to the chair, and then we'll go down to the gym. Okay.
Nice.
So
Okay.
those are their walking. All right.
Okay.
So can you tell me, kind of, let's review how you're going to do
Okay.
that.
So I'm gonna go here and then I'm gonna push
Right.
and stand up.
Okay. So here we go.
Okay.
Nice job. Wow. Okay, and we're going to go over to the chair there.
Alright.
Oop, you know what? Hold. If you're okay, I'm going to have you just stand over and
Okay.
get this. Don't want to forget this. That doesn't feel very good.
Yeah.
Okay. And over. And you know what? I'm going to have you stop for just a second because I
Okay.
don't have very much
Oh,
room here.
sorry about that.
Nope, that's fine.
Cut you
okay.
off, didn't I?
That's okay. All right.
Alright. And
So, do you remember what to
oh yeah,
reach
I'm
back
gonna
with?
reach back. Alright.
Okay. Take that leg out. Sit down.
Alright.
Nice job. And then go ahead and scoot. There
Oh,
you
should
go.
I scoot back?
Go just a little bit. There you go.
Okay.
Lean back. And remember about your knee.
Oh yeah,
you
you
can
bend my knee.
Yeah,
Sorry.
It's habit. People do that all the time. All right. How you feeling?
Good.
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 Sorry. I'm just gonna put this underneath the chair.
Alright.
Normally we put that in a little bag.